Hi students, today let's discuss regarding tonsillitis. So the definition of tonsillitis, it is an inflammation of tonsils. So here you can see that this is a picture of normal tonsil and this is an inflamed tonsil. Okay, so this condition is called as tonsillitis. The classification of tonsillitis, it is divided into acute tonsillitis and chronic tonsillitis. So first is acute tonsillitis. The incidence will be, age means it occurs frequently up to the age of 15 years. That is a peak age group in which the children will get higher chances for getting this tonsillitis. Both sexes are affected equally. Then duration of acute tonsillitis will be within 4 to 6 days. That's what is called as acute. It is sudden in onset and duration will be 4 to 6 days. Within 6 days, the infection will be subsided. The predisposing factors include endogenous factors and exogenous factors. The endogenous factors include pre-existing upper respiratory tract infection, then pre-existing chronic tonsillitis, postnasal discharge due to sinusitis and residual tonsillar tissue after tonsillectomy, lowering of resistance, exanthemata, then blood dyscrasias, example Hodgkin's disease and leukemia. So endogenous factors means the factors which are responsible for developing tonsillitis or the nearby structures that infected, so it can be extended into tonsillitis. Okay. Then exogenous factors include ingestion of cold drinks or cold food items. As we all know that after taking a cold drinks, sometimes patients may have difficulty to swallow food items or they may feel severe sore throat. Okay, so it's a kind of tonsillitis that can be aggregated by the consumption of cold drinks. Okay, then contagious means the infections can be contacted from other individuals having the same infection. Then pollution and crowded, ill ventilation environment and embedded foreign bodies. These are some of the exogenous factors which are responsible for developing tonsillitis. Then causative organisms, the main organisms responsible for developing tonsillitis include the bacteria like Streptococcus, Staphylococcus and Pneumococcus are responsible bacteria which are causing the tonsillitis infection. Then out of this, hemolytic Streptococcus has a special role for the tonsillitis. So these are some of the common bacteria which are causing the tonsillitis include Streptococcus, Staphylococcus, Pneumococcus, and in that the primary responsible microorganisms will be hemolytic streptococci. Okay, so it can occur due to some kind of viral infection also. Then acute tonsillitis is again classified into different form. First is acute catral or superficial tonsillitis. Okay, so it is in this tonsillitis is a part of generalized pharyngitis and is mostly seen in viral infection. So acute catral or superficial tonsillitis means it is a kind of generalized pharyngitis. So it can be seen in association with chronic pharyngitis. Okay, so this is a picture of acute catral or superficial tonsillitis. Okay. Then next form of acute tonsillitis is acute follicular tonsillitis, in which infection spreads into the crypts which become filled with purulent material presenting at the openings of the crypts as yellowish spots. Okay, so acute follicular tonsillitis means it is another kind of tonsillitis. It is mainly characterized by yellowish spots which can be seen on the opening. Okay, so the infection spreads into the crypts which become filled with purulent materials. It is a kind of severe infection characterized by the presence of pus. So this is a picture of acute follicular. You can see that this is a combination or yellowish spots can be seen though ഇതെല്ലാം purulent ആയിട്ടുള്ള മെറ്റീരിയൽ വെച്ച് കവർ ചെയ്തിരിക്കുന്നതാണ് ഈ ഒരു ഏരിയസ്. It is highly infectious when comparing with that of acute superficial infection. Then next is acute parenchymatous tonsillitis. Tonsil substance is affected. Tonsil is uniformly enlarged and red. So it is very inflamed as well as it will be having an appearance of red. Then acute membranous tonsillitis. It is a stage ahead of acute follicular tonsillitis when exudation from the crypts coalesces to form a membrane on the surface of tonsil. Okay, so these are the main four classifications of acute tonsillitis. First is acute follicular tonsillitis, acute catarrhal or superficial tonsillitis, acute follicular tonsillitis, and acute parenchymatous tonsillitis and acute membranous tonsillitis. So this is a picture of parenchymatous tonsillitis. When the whole tonsil is uniformly congested and swollen, it is called acute parenchymatous tonsillitis. So you can see that there is a uniformly enlargement of tonsils. Then classification. Acute membranous tonsillitis, it is stage ahead of acute follicular tonsillitis when exudation from the crypts coalesces to form a membrane that we have already seen here. Okay. Then, so this is a four picture of four kinds of acute tonsillitis. This is acute catarrhal tonsillitis, this is acute follicular tonsillitis, and acute membranous tonsillitis. The signs of tonsillitis include tonsils become congested and swollen in nature due to the inflammatory reactions, and secretions increase and to become tenacious in nature. Movements of the palate become impeded due to the pain, because we can't move the palate as it gets pain while trying to move. Then halitosis means bad breath. Due to the infectious purulent materials can be present within the tonsillar structure, so the patient breath will be having a bad odor. Jugular-digastric nodes get enlarged and tender. Due to the chronic stage of tonsillitis, the nodes become enlarged. Okay. The symptoms, what are the common symptoms that the patient may present in case of an acute tonsillitis? First is raw sensation in the throat. So as we all know that even after taking a cold drink or cold food items, patient may have a severe pain as well as an irritation over the throat. So that is one of the most common symptoms that the patient may exhibit. Throat pain, which may be referred to the ears. In the initial stage, the throat pain is located into the throat area, but in the later stage, it can be referred to the ear also. Then refusal to eat. The patient may be having difficulty to swallow the food item, so they may refuse the food. Voice may be thick and muffled in nature. Then constitutional symptoms like fever, malaise, headache, and tachycardia along with infection, because it's a kind of infection, so it is mainly associated with fever. So this is a picture of tonsillitis, red swollen tonsil due to the inflammatory reactions. It will be red in color. Headache. Throat pain can be extended to the ear or to the head. Then sore throat can be seen, snoring, painful swallowing, and fever. Treatment. How we can treat this condition? Bed rest and soft diet are advised because the patient is getting severe difficulty to swallow the food items, so we should provide them with a soft diet. Antibiotics can be effective to control the bacterial growth over the throat area, so for that we can use penicillin. That is a drug of choice for tonsillitis. Patients allergic to penicillin can be treated with erythromycin. Antibiotics should be continued for 7 to 10 days. That is the duration of taking the antibiotics. Analgesics, it will be help to relieve the pain. So for that we can use aspirin or paracetamol, the group of drugs that we can use to relieve the pain. Then warm saline gargles, it will be very effective to relieve the sore throat as well as the throat irritation. To relieve throat irritation. Lozenges means with the local anesthetic action may be comforting. Lozenges means it's a kind of tablet, medicated tablet that can be chewed very well. So it will give some soothing effect on the throat. Complications of acute tonsillitis. Quinsy. If the infection is not treated well, it can cause severe abscess formations in the peritonsillar area. So this is called as quinsy or peritonsillar abscess. Then laryngeal edema, parapharyngeal and retropharyngeal abscess. So pus formations can be extended into the pharyngeal spaces. So it is called as parapharyngeal or retropharyngeal abscess. Acute otitis media, then septicemia, it's a kind of severe infection, then chronic tonsillitis. So these are the form of complications of acute tonsillitis. Quinsy or peritonsillar abscess, laryngeal edema, parapharyngeal and retropharyngeal abscess, acute otitis media, septicemia and chronic tonsillitis. So till now we were discussing regarding what is tonsillitis and acute tonsillitis in detail. Okay, in that acute tonsillitis is again divided into four groups: catral tonsillitis, follicular tonsillitis, membranous tonsillitis, and parenchymatous tonsillitis. Next, we can discuss regarding the chronic tonsillitis. It is a complication of acute tonsillitis. It is a chronic infection of the tonsils. Chronic infection of the tonsil is characterized by recurrent acute attack. If the patient is suffering from recurrent attack of acute tonsillitis, it can be considered as chronic tonsillitis. The types. Again, this chronic tonsillitis is divided into follicular tonsillitis, parenchymatous tonsillitis, and fibroid tonsillitis. Chronic follicular tonsillitis means tonicular crypts are full of infected cheesy material which shows on the surface as yellowish spot. Follicular will be characterized by yellowish spot due to the severe infection. It is mainly occurring in adult. Chronic parenchymatous tonsillitis means there is hyperplasia of lymphoid tissue. Lymphoid tissue will be multiplied in number. Tonsils are very much enlarged and may interfere with speech, deglutition, and respiration. Completely occluded the functions of tonsils, like it will interfere with the speech, and deglutition means swallowing of the food items, and respiration. Attacks of sleep apnea may occur, and it is a characteristic feature in children. Chronic fibroid tonsillitis means tonsils are small but infected with history of repeated sore throats. It is mainly characterized by recurrent attack of sore throat. The etiology of chronic tonsillitis, which may be complication of acute tonsillitis. Chronic tonsillitis വരുന്നത് acute tonsillitis complication ആയിട്ടാണ്. Then subclinical infections. Okay. Then predisposing factors like chronic infection in sinus or teeth may be a predisposing factors. If the patient is having any kind of teeth infection, if it is not treated well or managed well, it can be extended into the tonsils and cause chronic tonsillitis. Or if the patient is getting some kind of sinusitis also, it can be extended into tonsils and cause chronic tonsillitis. Incidence mostly affects children and young adults, but in case of acute tonsillitis, the peak age of getting this kind of infection was less than 15 years of age, isn't it? But the incidence of chronic tonsillitis, it will affect in the children as well as in the young adults. Then signs of chronic tonsillitis. On squeezing the tonsils, pus may come out. ഇപ്പോഴും chronic tonsillitis purulent ആയിരിക്കും nature. So while trying to squeeze out the tonsils, the pus will come out, which shows a severe infection. Retention cysts may be occasionally seen on the surface of the tonsils. They appear as cystic yellowish swellings containing yellow liquid and debris. ഇപ്പോഴും yellowish cyst can be seen on the surface of the tonsil. It will be a complete form of pus collection. Okay, the knots, presence of persistent enlarged jugulo-digastric knots is significant sign. Chronic infections വരുമ്പോൾ lymph nodes will be get infected. So it is another kind of symptoms. So this is a jugulo-digastric knots. So in the chronic infection, so you can see that in this area the tonsils can be seen. So if the infection is not treated well, it can be extended into this knots, and automatically it will be inflamed. The symptoms: recurrent throat pain, that is a severe form of or typical sign of chronic tonsillitis. Then cough, halitosis due to the cheesy material in the tonsillar crypts. Cheesy material which will be purulent in nature, which means pus productions ആയിരിക്കും. So halitosis means it's a bad breath. Okay. Then quiescent phase means the patient may have work discomfort in the throat with irritation and pain. Often the patient is completely asymptomatic in this phase. ഒരു ടേം ആണ് ക്വിസന്റ് ഫേസ് എന്ന് പറയുന്നത്. പേഷ്യന്റിന് ഭയങ്കര ഡിസ്കംഫർട്ട് ആയിരിക്കും, പക്ഷേ ഈ സമയത്ത് പേഷ്യന്റിന് പർട്ടിക്കുലർ സിംറ്റംസ് ഒന്നും കാണിക്കത്തില്ല, ലൈക്ക് ഫീവർ കാണത്തില്ല, സോർ ത്രോട്ട് കാണത്തില്ല, ബട്ട് സം കൈൻഡ് ഓഫ് ഡിസ്കംഫർട്ട് ഓർ ദി ത്രോട്ട്, ലൈക്ക് ഒരു ഇറിറ്റേഷൻ കാണും, പെയിൻ കാണും. The treatment, how we can treat this chronic tonsillitis? First of all, the diet. We should provide nutritious diet, and vitamins may help the resolution of mild cases of tonsillitis. We can improve the immunity power of the patient so that we can control these complications or severity of illness. Antibiotics and analgesics can be given to the patient to prevent the recurrence of attacks. Antibiotics will be helpful to prevent the bacterial growth, and analgesics will give some kind of relief from the throat pain. Tonsillectomy is an advice for patients having recurrent chronic tonsillitis. If the patient is getting infection with a recurrent form of tonsillitis, we can manage with a surgery called tonsillectomy. Diet പറയുമ്പോൾ we should avoid or decrease the intake of cold food items. Tonsillectomy. So it's a surgical removal of tonsils. Okay, this ectomy means what? Removal. Okay. Tonsil means tonsillectomy means removal of tonsils. The indications for tonsillectomy include local, focal, and general. Local means if a patient has having any lesion in the tonsil, it can be removed. Focal means a neighboring organ is affected by the tonsil. In case of an adenoids, the tonsils are inflamed, automatically it may extend to the adenoids and cause adenoiditis also. In those situations, we can perform this tonsillectomy. The general indications for tonsillectomy include the tonsil act as septic foci to a distant part of the body. So, tonsil എന്ന് പറയുന്നത് ഒരു സെപ്റ്റിക് ഫോക്കി അല്ലെങ്കിൽ സോഴ്സ് ഓഫ് ഇൻഫെക്ഷൻ ആക്ട് ചെയ്യുകയാണെങ്കിൽ we can perform tonsillectomy. The indications of tonsillectomy is divided into local and focal. Local indications include chronic tonsillitis, quinsy or peritonsillar abscess, diphtheria, foreign body, tonsillolith, then benign tumors, hypertrophic tonsils, and sleep apnea. So these are the local indications. Okay. Focal indications include persistent jugular-digastric non-specific lymphadenitis, persistent tuberculous jugular-digastric lymphadenitis, and eustachian tube affection. Okay, these are the typical indications of tonsillitis. The general indications include in the CVS that will rheumatic heart disease, genitourinary system, that is acute glomerulonephritis, respiratory system, that is chronic bronchitis, bones and joints, that is rheumatic arthritis, skin recurrent urticaria, eyes episcleritis, choroiditis, and standard growth due to the recurrent infection. These are the general indications for performing tonsillectomy. Then, contraindications of tonsillectomy, it is again divided into local and general. Acute tonsillitis. If the patient is having an acute tonsillitis, it cannot be performed. It is an only management during the recurrent attack of chronic tonsillitis. Okay. Then other acute upper respiratory tract infection, because it can increase the chances for hemorrhage and the spread of infection will be high. General indications include age less than 5 years of age, diabetes mellitus, hypertension, bleeding disorders, and tuberculosis infection. The methods of tonsillectomy. We can perform the tonsillectomy by either one of these methods. First is dissection, guillotine, electropottery, cryosurgery, or laser surgery. So we can perform as per the patient's conditions and tolerance level. We can use either of this method. The premedications, or prior the surgery, we can provide the medications such as atropine. It should be administered half an hour before the operations to reduce the amount of saliva formations. അതായത് tonsillectomy ചെയ്യണമെങ്കിൽ we should control saliva production. So for that we can provide atropine. Antibiotics, along with the calcium and vitamin C and K, we can provide antibiotic therapy for 3 days before the operations to prevent this risk of infection. Antiemetics and sedatives can be given. Anesthesia, it can be performed either by local anesthesia or by general anesthesia. Local anesthesia can be used in patients of cooperative patients. The throat is sprayed with 4% liquid solution. Through that, we can sedate the area. General anesthesia is mainly by intratracheal intubation. The position of the patient for tonsillectomy include the patient should be lied in supine position with extension of the neck for the operations under general anesthesia. Semi-sitting position is advised for tonsillectomy and local anesthesia. If you are performing this tonsillectomy under local anesthesia, we can provide the position of semi-sitting position. There is no need to supine or lying down position. But if you select supine position, the general anesthesia should be general anesthesia. Okay. First is the dissection method. Dissection means what? We have to remove that tonsil. Okay. The steps include, first of all, exposure. The mouth is opened with a mouth gag under general anesthesia. Incision. A J-shaped incision is made along the edge of the anterior pillar with the tonsil knife having number 12 blade. Dissection. The tonsil is dissected by pulling it medially with the tonsil holding forceps or loop forceps. Hemostasis is carried out by pressure of gauze and by tonsillar artery forceps. ആദ്യം മൗത്ത് എക്സ്പോഷർ, അതായത് മൗത്ത് ഓപ്പൺ ചെയ്തതിനു ശേഷം നമ്മൾ ടോൺസിൽസ് എവിടെയാണെന്ന് കണ്ടു, അതിനുശേഷം ജെ ഷേപ്ഡ് ഇൻസിഷൻ കൊടുത്തു, അതിനുശേഷം ഡിസെക്ട് ചെയ്തു ത്രൂ ടോൺസിൽ ഹോൾഡിംഗ് ഫോഴ്സെപ്സ് ഓർ ലൂപ്പ് ഫോഴ്സെപ്സ്. ആഫ്റ്റർ ദാറ്റ് we have to maintain a hemostasis, so prevent bleeding by pressuring by applied pressure after inserting a gauze spike apply ചെയ്യാം. Guillotine method means insertion. The guillotine is an instrument which can be inserted like a tang depressor and feeding the tonsil. The tonsil is fed into the fenestra of the guillotine is depressed towards the opposite cheek. Closure. The handles of the guillotine are approximated to cross the fenestra. Excision. The guillotine is twisted towards the midline. The tonsil is avulsed from the fossa. So this is a picture of guillotine. So first we have to insert this tonsil guillotine and we have to palpate the area and capture the tonsils and we can remove it. Electrocautery. We can use the electricity to cauterize the tonsillar growth. Cauterization of the tonsil results in fibrosis and prevents subsequent attacks of tonsillitis. Completed through that we can suppress the growth of this attack of tonsillitis. Cryosurgery tonsillectomy is useful in patients with blood dyscrasias. It is a contraindication to perform tonsillectomy. For that we can perform the cryosurgery. Laser tonsillectomy, it involves less bleeding, faster healing, less post-operative pain and scarring. It is very expensive in nature. So when compared with other form of tonsillectomy, it is very, it will provide less complications like bleeding, and the healing rate will be faster than that of other kind of methods. And the risk of post-operative complications are very much rare, but it cannot be affordable for many patients as it is very expensive. So this is a picture of laser surgery we can perform by using a beam of laser therapy. Post-op management, it includes nursing management also. Okay. The diet. Nothing by mouth is given till the patient comes out of anesthesia, or else it may cause severe aspiration. Cold feeds are advised for first 48 hours to reduce bleeding. It will cause vasoconstriction, so should provide cold feeds. Soft non-spicy diet is given for a week from the third day. Patient should be encouraged to swallow to prevent the stiffness of the pharyngeal muscles. If the patient is not able to swallow the foods for a long period of time following tonsillectomy, there will be chances of stiffening of that pharyngeal muscles. അതായത് കണ്ടിന്യൂസ് പേഷ്യന്റ് ഫുഡ് എടുത്തില്ല എന്നുണ്ടെങ്കിൽ അല്ലെങ്കിൽ കഴിച്ചില്ല എന്നുണ്ടെങ്കിൽ pharyngeal muscles stiff form. So in the later stage, patient is getting severe difficulty to swallow the food items. Position. Following surgery under general anesthesia, the patient is given tonsillar position where the head is kept low. Patient lies in the lateral position to prevent aspiration of blood. Immediately after the tonsillectomy, there will be higher chances of getting aspiration. കാരണം bleeding tendency ഉണ്ടാവും, അത് aspirate ചെയ്യാനുള്ള risk ഉള്ളത് കാരണം we should provide a lateral position to the patient and a head should be kept low. Even if the surgery is done under the local anesthesia, patient may lie down or maybe a semi-sitting position that is very comfortable for the patient. Then observe the patient for any signs of bleeding or dyspnea. It is a kind of complication, so we have to report it immediately to the concerned surgeon. Monitor the vitals, especially the temperature, pulse and respiration for the first 4 hours. If the patient is getting severe tachycardia, it can be a sign of bleeding or it's a kind of infection. Antibiotic are prescribed for 6 to 7 days to complete or prevent the risk of infection as well as to heal the wound. Analgesia should be given for 1 week to control the pain. To up to 1 week, patient may be having severe pain while having food or talking. In the situations also, we should provide analgesia to get the relief from. Gargles, condyle gargles, which includes 1:4,000 potassium permanganate as strength, or diluted hydrogen peroxide gargles are advised after every feed for 8 to 10 days. കാരണം gargles കൊടുക്കുമ്പോൾ it will be given a feeling of soothing effect. The complications of tonsillectomy include immediate complication and delayed complication. Immediate complications include bleeding tendency, trauma to the adjacent structures, and anesthetic complications. If it is done under general anesthesia, the patient may be having severe complications. Delayed complications include bleeding, infection, change of voice, granular pharyngitis, lingual quinsy, and exacerbation of distant infection. Okay, so in this session we had seen regarding tonsillitis. It is an infection or inflammation of the tonsil. It is divided into acute and chronic. Acute is again divided into acute follicular, acute superficial, parenchymatous, membranous, and chronic type we have seen. And the predisposing factors, exogenous factors and endogenous factors, and signs and symptoms like sore throats or pain, difficulty to swallow food items, halitosis, etc. And the method of management. Main management is tonsillectomy. It can be done under general local anesthesia, and we had seen the steps in each method, like dissection method or laser surgery, cryosurgery, etc. And we had seen the complications like immediate complications and delayed complications, as well as the post-operative management. Okay, so please go through this note. If you have any doubt, you can contact me. Okay, thank you.